a lot of parents aren't aware that there's vaccines recommended for children after they get that kindergarten series. Most families today expect that their infants are going to get a number of shots, and that then they also will get a number of vaccines prior to starting kindergarten, right around their 4th or 5th birthday. But many parents aren't aware that we actually have now recommendations for universal vaccination of 11 to 12-year-olds, our sort of adolescent or pre-adolescent age group. And those include the tetanus, diphtheria, pertussis. So this is a tetanus booster that also has whooping cough in it. Includes the flu shot when it's the appropriate time of the year, which is mostly going to be into the fall and early winter. It includes human papillomavirus, the HPV vaccine, and meningococcal, which is the meningitis vaccine. And we recommend those for all 11 to 12-year-olds, both males and females. Human papillomavirus is a very important vaccine for all young people to get. So the HPV vaccine protects against HPV-related cancers, which include cervical cancers, anal cancers, and head and neck cancers, things in like the tongue, the throat, and those sorts of things. And so these are very growing importance as we learn more about the types of cancers that are caused by HPV, and we're learning that more and more cancers affecting both males and females are caused by this infection. The vaccine is incredibly effective at preventing HPV-related disease. So it is particularly for those who receive it earlier, 11 to 12 years of age, before they've been exposed to the virus. It is incredibly effective at preventing cancers, precancerous lesions, which might cause abnormal pap smears and subsequently cause young girls and women to have to go through extra procedures and so forth. So we are universally recommending it to everyone. I think one of the most helpful websites, the Centers for Disease Control and Prevention, has a very good immunization website, and they have a whole section for adolescent vaccines such as HPV, and then for the infant vaccines, and they actually have information directed towards parents, directed towards teens, and so forth, so that parents can find accurate information about these vaccines. The CDC website says this as well. All of the vaccines, HPV, Tdap, flu, and the meningitis vaccine, are absolutely been shown to be very safe. Just as safe as every other vaccine that we give to our children and infants. So parents often worry because it's a relatively new vaccine or new to them. Is it safe? Has it been well studied? And so forth. And so far the safety data for all of these shots has been just as safe as all the other vaccines we give. And I tell parents, compared to a lot of other things we do in medicine, medications, interventions, procedures, vaccines are incredibly safe.